Good day. My name is Paul Edwards, the one of the owner along with my wife of Possibilityplus Sales and Marketing Service. Primarily, we are a ministry, but we believe that the gospel touches every area of our lives. So the gospel must impact us spiritually. It must impact us physically. It must impact us financially. And therefore, once we apply the principles, the gospel will help us in every area of our lives. But today I want us to talk about health. And I was reading an article speaking about high blood pressure, because we know that high blood pressure is what is called the silent killer, and especially amongst black Indian persons like myself. So this article was done by epidemiologist Christine Biban Domingo of the University of California, San Francisco, stated in April 2021. And she was looking on how exercise affects individuals as we age. The study was they studied over 5,000 individuals in four cities in 4 cities in the US. And she was looking to see how exercise when we are early in our lives will help us to maintain good blood pressure level. Now, high blood pressure or hypertension is a dangerous illness that affects billions of people globally. It increases the risk of stroke and heart attack, as well as dementia in later life. The World Health Organization estimates that around every fifth woman and up to 1 in 4 males suffer from hypertension. However, high blood pressure is sometimes referred to as the silent killer because most of its sufferers are unaware that they have it. So it's very important that we consult our physicians and have a regular checkup to make sure that our blood pressure is in order, right? So in the study, as we said, it included over 5,100 participants. And the study, they followed their health over a 3-year period using physical examinations and questionnaires about their alcohol consumption, smoking status, and exercise routine. Every time a clinical evaluation was conducted, blood pressure was taken 3 times 1 minute apart. At each clinical assessment, participants were divided into 4 groups based on gender and race for the data analysis. Between the ages of 18 and 40, levels of physical activities fell precipitously for both men and women, as well as both racial groups. Over the next few decades, rates of hypertension increased and physical activities decreased. So what they're saying is, they notice that as we age in both men and women, physical activities decrease and hypertension increase. The researchers concluded that young adulthood is a crucial time frame for implementing health promotion initiatives aimed at increasing activities to prevent midlife hypertension. Nearly half our participants in young adulthood had suboptimal levels of physical activity, which was significantly associated with the onset of hypertension, indicating that we need to raise the minimum standard for physical activities. stated main author Jason Nagata, a young adult medical specialist. So in other words, what the study showed was that the more active you are, the lower your risk of hypertension. The less active you are, the higher your risk of hypertension. Now, one of the interesting facts is that let me read this part. That the levels of activity significantly reduce the risks of hypertension, particularly if the participants continued their exercise regime until they were 60 years old, achieving at least twice the current minimum adult physical activity guidelines may be more beneficial for the prevention of hypertension than simply meeting the minimum guidelines. So if you have a higher activities more than the minimum guidelines, they says you have a greater chance of reducing your hypertension. But increasing weekly physical activities in the face of life-altering choices and mounting responsibilities is not simple. This could be particularly true following high school, when chances for physical activity decrease as young people enter the workforce, colleges, and parenting, and their time is eaten away. So again, what they realized is the younger we are, when there's less responsibility, the more active we are. But as we begin to work, as we begin to have children, as responsibility increase, we find that our time has been reduced. And now we have less time for physical activities. Another disturbing fact revealed by the study is that Black men and Black women health trajectories differ significantly than those of their white counterparts. While Black individuals' levels of physical activities continue to drop, white men and women levels plateaued at age 40. White women in the study had the lowest rate of hypertension into midlife, but Black women overtook white males in this regard by 45 years. Furthermore, by the age of 60, about half of white women and slightly less than 70% of white men develop hypertension, compared to 80 to 90% of Black men and women. The study attributed this well-known racial discrepancy to a variety of social and economic issues. While high school education was mentioned, these factors were not evaluated in the study. Although black male youths may have higher engagement in sports, socio-economic factors, neighborhood environments, and work or family responsibility may prevent continued engagement in physical activities through adulthood. So what they are saying in the study is that they noticed that a higher rate of Black men and Black women have hypertension in comparison to white men and white women. And so taking good care of our diet, of what we eat, and incorporating exercise in our lifestyle is very important. And so I want to encourage all of us to make sure that we incorporate exercise in our lifestyle. We make sure our diet is better. That means we incorporate more vegetables, reduce carbohydrate, have a balanced diet, put it that way. Increase more fruits in our intake, take the right supplements. In my link below, you are going to see some supplements that I take that might help you. But the important thing is follow the advice of your doctor and get yourself checked up. Have a blessed day. My name is Paul Edwards with Possibility Plus Health.